Welcome to Friday's edition of COVID-19. The global death toll from the pandemic has surpassed 2 million, while the tally of infections worldwide moves closer to the 100 million mark. I have Khonsoa standing by with more on these numbers, which will be followed by a broader look at the latest on the local front. So I'll just start us off with the updates for this Friday then.
Sunny, the work week is ending with a slight decrease in COVID-19 cases as 513 infections were reported this Friday, which means for the second straight day, domestically transmitted cases are below 500. And if we go over to our graph, we see that for the fourth straight day, daily infections have also been in the 500s. And with that, the average in the past 7 days stands at 555. And the number of domestically transmitted cases in the past 7 days is at 523. So this meets the criteria for level 2.5 social distancing measures, which are currently in effect in the metropolitan region and a few other places, while the rest of the nation is under level 2. And speaking of which, these measures are going to be in effect until Sunday, with the government set to make an announcement regarding a revision or an extension on Saturday morning. Now, we will have more on what we can expect with our Songyeon in a bit. And there might be some revisions, not only due to the recent decline that we are seeing, but also the shift in the trend of where infections have recently occurred. So here's a senior health ministry official regarding that.
다중이용시설 등의
The proportion of cases linked to cluster infections has dropped to 30% from 50% in November. Instead, the proportion of transmissions linked to contact with infected individuals has risen from 20 to 40%.
And that also seems to be explaining why we are seeing still cases scattered across the nation, although we do see an overall decline in numbers. And the total number of infections here in the country as of this Friday stands at 71,241, and we have 22 new fatalities, raising the death toll to 1,217.
Right, so and speaking about the death toll, as I mentioned at the start, the global death toll is rising at a frightening pace.
Exactly, Sunny. As of Friday, Korea time, over 2 million people around the world have lost their lives due to this highly contagious virus, which means a year and 14 days after the first outbreak in China's Wuhan province and in Wuhan city, that is. And that is also why a panel of experts from the World Health Organization is currently there to investigate the source of the outbreak. And now let's take a look at the detailed figures now. The total number of cases stands at 93.5 million, and also the death toll as of 12 p.m. Korea time now stands at 2,02,347. And as of this Friday, there are exactly 10 countries around the world that have over 2 million total infections, including Germany. And if we take a more detailed look at the daily increases, we have these countries are having new COVID-19 variants or are suspected to have new variants, which is likely the reason for the rise in daily cases. We have Brazil here with over 68,000 new infections reported in just a day, and also the UK 48,000 cases, and South Africa over 18,000 cases. And those are the updates I have for now. I'll be back with more on Monday. Back to you, Sunny.
All right, so thank you for that. Right, now we take another look at the COVID-19 situation here in the country as we usher in the weekend, during which officials will announce their stance on social distancing. I have Kim Sang-hyun here in the studio with me. Welcome, Sang-hyun.
Good afternoon, Sunny.
Right, so despite the decline in daily tally, officials are calling for continued public vigilance.
That's correct. The government has cautiously suggested that this week the country's third wave is indeed gradually subsiding. In fact, the number of new cases in the country is hovering around the 500 mark for the fourth consecutive day. Now, Kwon Jun-wook, deputy director of the KDCA, noted in Thursday's briefing that the country had achieved a notable feat in stabilizing the outbreak without resorting to level 3 social distancing measures. Take a listen.
이번에 거리두기 효과에 대해서는
We were able to prevent cluster infections at public use facilities through a ban on gatherings of 5 or more people as well as travel restrictions. It is our belief that the outbreak has transitioned into a decline phase thanks to these measures, without having to raise our social distancing guidance to level 3.
However, he cautioned that the number of cases had often rebounded in the past when the country loosened its social distancing guidelines, which is why he called on the nation to remain vigilant. Prime Minister Chung Se-kyun yesterday also warned that those who undermine the government's containment efforts would be stiffly punished amid growing concerns over a recent outbreak at a missionary church.
Right. Now, Sung-yeon, while an official announcement will be made this coming Saturday, there is strong belief that authorities will largely maintain their current measures.
Right, so that's what we are expecting at the moment. It seems now, according to authorities, there's an underlying consensus that the current measures will be kept intact along with the ban on gatherings of 5 or more people. Yoon Tae-ho, a senior health official, said yesterday during a meeting with reporters that many in the government believe restrictions cannot be lifted immediately. He added that although daily caseloads have dropped to around 500, it is still a lot compared to figures we saw in the first and second wave of the pandemic, and that any abrupt changes in the social distancing scheme could lead to a fresh rebound in new cases. Nevertheless, health authorities are expected to partially ease restrictions on high-risk facilities, including gyms, singing rooms, and cram schools, amid concerns over the impact on their businesses. Now, in the meantime, authorities also highlighted that during the third wave, caseloads had steadily risen over the course of a month and a half, and it will be safe to conclude that the outbreak has been brought under control only if the current downward trend is maintained for longer than that time period. Successfully managing the outbreak is crucial for the government to ensure a safe vaccination campaign, and also ahead of the Lunar New Year holidays, which is a time of year when many people usually travel. Now, on that note, the government will be making an announcement tomorrow on its preventive guidelines for the Lunar New Year holidays as well.
I see. Well, that's good to know. Switching gears then, what is the latest, Sung-yeon, on the treatment front?
Right, Sonia, a number of the local pharmaceutical companies, they're preparing to roll out their COVID-19 treatments. Now, we do have firms like GC Pharma, Daewoo, and Jonggeundang. They are set to follow in Celltrion's footsteps with drugs of their own as well. Many of these treatments are now pending emergency use approval from Korea's drug regulator. Just one day after Celltrion reported positive top-line data from its antibody drug, another local drug maker, Jonggeundang, reported promising phase 2 trial results from its own drug, nefamostat. Tested on over 100 people in Russia, 36 of them high-risk patients, nefamostat improved patient outcomes in 61% of the cases, according to the company. It also shortened the recovery time from an average of 14 days to 10 days. Meanwhile, Celltrion's antibody therapy, the first homegrown treatment to secure regulatory approval, is expected to be administered to high-risk elderly patients very soon. As for GC Pharma's blood plasma treatment, it has completed phase 2 clinical trials involving 60 test subjects, and test data is currently being analyzed as it also awaits approval. Meanwhile, Daewoo Pharmaceuticals' Camostat treatment recently started phase 3 trials and may be submitted for emergency use authorization for mild and moderate cases in the near future.
Right, Sung-yeon, before you go, one final question. What can you tell us about our upcoming inoculation campaign?
Right, so the government announced that the plan is to have everybody vaccinated by September of this year, and the ultimate goal is to achieve herd immunity by November of this year. Let's take a listen.
The government plans to begin vaccinations in February and complete them by the third quarter, likely by the end of September. Normally, immunity forms 3 weeks post-vaccination, or in the case of vaccines that require 2 doses, they take about 2 months' time. So our goal is to achieve herd immunity by the end of November, just prior to the winter season.
So all in all, the government expressed high hopes that starting next month, local treatments and imported vaccines will help mitigate the COVID-19 situation here in Korea.
And we'll keep our fingers crossed for that. All right, Sung-yeon, as always, thank you for the coverage.
Thank you for having me.
Right, authorities in neighboring Japan have expanded their state of emergency from the Greater Tokyo area to 7 more prefectures amid alarming COVID-19 tallies in recent days. On Thursday alone, the country reported some 6,600 cases. For more on the situation there, I have Hiroaki Wada live on the line. Hello again, Hiroaki.
Hi, good to see you. Thank you for having me.
Right. Hiroaki, now along with the broader declaration of emergency, I believe authorities have adopted some stringent restrictions to tackle the unsettling COVID-19 situation there. Please tell us more about them.
Right. As you mentioned, the state of emergency declaration was expanded. And on top of that, now the government has stopped business travelers from certain countries like China or South Korea and 9 other countries from entering the country. It was a little bit later than many people have expected, but the government had to respond to some criticism that it's too late to do that. And it is also thinking about banning Olympic athletes from entering the country for training or other purposes, again, in consideration of public criticism of government's passive slowness in stopping foreign entry into Japan. And they also suspended travel and promotion programs and continue to pay subsidies for businesses suffering from the economic downturn. They're saying that they want to introduce vaccination by late February, but some local governments are complaining that they don't have enough information to implement that. Yeah, that's about it. Mm-hmm.
Hiroaki, what restrictions, meanwhile, are included under the state of emergency?
Right, and you have to understand that basically what the Japanese government is saying is that on its request basis in principle. So they can't really force or order people to do what they tell them to do. But anyway, the duration for the emergency rules are until February 7th. It's possible to be extended. Restaurants need to close at 8 p.m. and they can serve alcoholic drinks up until 7 p.m. And the government wants people to work from home, 70% of them, but it's difficult. It's really high goal to achieve. And the authorities are also telling people not to go out except in necessary cases. But again, we see more people on the streets in certain parts of population centers like Tokyo or Osaka compared to the last state of emergency declaration in April. So people are not really listening to what the government is saying. The government also tries to curb attendance at sports events and concerts, and also and they're also saying that if some businesses don't comply with their request, they may release the names of those rule breakers. Yeah.
So Hiroaki, what is the general public response then to these measures?
Well, people are really unhappy about the government's response. People are saying it's too little, too late, and they change policies quite often. It's flip-flop, you know. And the Suga cabinet's approval rating is now hovering around 40%, while the figure was like more than 60% in mid-November. So people really don't like what the government is doing or failed to do to contain the spread of the viruses. Now, 60% of people say they say no to the government measures, and only 30%, less than 30% supporting it. And some people, you know, one thing we are worried a lot is the college entrance examination to be held later this week. It's a big thing in Japan too, like in South Korea. 500,000 people applied for it, and school officials are taking every measure to make sure it can be carried out safely. But still, there will be a big number of young people gathering at certain locations and universities, and people are waiting what would happen with their fingers crossed.
And does the government have any additional measures to deal with or to prepare for, that is, the college entrance examinations there?
Well, I mean, they have requested the universities to take measures like keeping exam takers' distance wider, or having them to receive some measures before they enter the rooms. But, you know, again, there are a big number of people gathering, and we have to wait and see what will happen.
Hiroaki, meanwhile, I also hear the patients suffering from severe symptoms stands at well over 900, and fatalities are also on the rise there. What or how is the medical system in Japan coping with this reality?
Doctors are really, really worried. The chief of the Japan Medical Association recently said that the grasping of the medical system is proceeding across the nations, and many doctors may soon have to do triage, selecting which patients they are going to save and, doing that kind of thing. So medical groups are working close to find more beds for COVID patients, but the number is still not enough, obviously, at least if you look at the sharp increase in the number of people with serious conditions. And there are even people who are dying at home while they are waiting to be hospitalized. And even when they are trying to find some hospitals to be received, there are some reports about people refused like more than 20 times after finally they find a bed to be admitted. So it's really serious. Doctors, nurses exhausted, and health centers, which are supposed to track patients, are overwhelmed because they don't have enough number of staff. So they cannot really track patients. They have to prioritize which is most serious cases.
I see. And given those circumstances, Hiroaki, what are the prospects of the Summer Olympics in Japan this year?
It's a really good question. As you may be aware, the Prime Minister told Bill Gates that he is determined to carry out the Olympics by all means. But again, as I mentioned earlier, they even stopped Olympic athletes from entering the country because of fear of further spread of COVID-19. And Japan has not started vaccination yet. And you see all the spread of the serious cases across the globe. And we have like less than about 6 months from now to have the Olympic Games. So a lot of people are saying that, well, maybe we have to make a decision soon about whether we can do the Olympics this year again or not.
Right. Hiroaki, one final question. What can you tell us about the variant from Brazil that has been detected in Japan?
Right. 4 people who arrived in Tokyo on January 2nd were found to have this new variant. And this finding was announced by the health ministry like 5 days ago. At that point, health authorities are saying that they don't have any evidence that this new variant is more dangerous than the existing ones, like those from UK or South Africa. Nevertheless, they are still investigating the true nature of the new variant and try to find out if they have more affecting infectious power, they may cause any serious conditions or affect the efficacy of vaccines. Here again, we have to wait and see what the finding of the health authorities would be.
I see. All right, Hiroaki, as always, thank you very much for making the time to join us with your coverage.
Thank you so much for having me.
정부는 문화예술인들이 마음껏 창의력과 끼를 발휘할 수 있도록 예술 창작 활동을 지원하고 한류 콘텐츠의 디지털화를 촉진하는 등 문화강국의 위상을 더욱 확실하게 다져나가겠습니다.
The pandemic has led to unprecedented challenges for productions of movies, musicals, and more. Accordingly, theatres are looking to transform themselves to reach audiences amid this global health crisis, and we'll look at the measures underway to better assist these efforts. I have Professor Chi Hae-won from Kyunghee University. Welcome back, Professor Chi.
Good afternoon.
And I also have Pierce Conran from the Korean Film Council. Welcome, Mr. Conran.
Thanks very much for having me.
Mr. Conran, let's begin with the impact of the third wave on movies and theatres, as there have been more stringent measures on social activities to contain this latest outbreak.
Absolutely, it's been very difficult. Obviously, the pandemic has been a calamity for the film industry among any other industry for quite a long time now. But this third wave has made things more complicated, especially because since December 8th, since we kicked up to that 2.5 level social distancing level, theaters, cinemas had to shut at 9 p.m. And that, of course, is peak viewing time, prime time to go and see films. So on top of all the other problems, this has made things very, very difficult. As a result of that, we've reached a new record low at the box office. Over the previous weekend, there were 81,000 tickets sold. To put that in context, a typical non-pandemic slow weekend would be about 1 million ticket sales. So that's a pretty big drop, and that was 20% lower than the previous record, which was of course set earlier during the pandemic back in April. So it's even though cinemas never completely closed in Korea, we're now reaching kind of a very difficult time, and there's no one going to the cinemas at the moment. Hopefully things will change a little bit. We're all looking to the weekend to see if these social distancing levels will be changed a bit. If they're modified, perhaps audiences will be able to kind of go back to cinemas, and hopefully that means that new content will arrive as well. There have been very few films have been released. Warner Brothers released Wonder Woman 1984 because they were releasing it all around the world. And one Korean film came out last month called Josie. The only reason it came out is because the production company behind it, which happened to be Warner Brothers Korea, was wrapping up their operations in the country, so they couldn't delay it any longer. That was, of course, unfortunate for the film because no one got to see it. So quite a difficult situation at present.
Right, and staying with that, Mr. Conrad, what can you tell us about Korea's box revenues for last year? Box office revenues, that is.
They're not very good. Again, obviously down about 70% year on year. But there's kind of a bright spot there, at least if we compare that to other countries where theaters were closed. So people were still going. It's one of the better box office markets, even though it's been throttled as it has been. It doesn't compare quite to, say, China and Japan have done much better. But and there have been a number of films were released, not as much as we would normally see. So there's kind of a backlog of content, but films have been released, and some of them did make money. Those include Deliver Us from Evil, an action film that came out in summer. We had the Train to Busan sequel, Peninsula, also came out, and I think it reached its break-even point in Korea, but that chiefly made money through international sales because the first film had been such a global hit. We also had the film Samjin Company English Class, which did quite well around the Chuseok period, in October. So, but beyond those three films, I'm not sure if any other major film actually reached its break-even points, but not all that many were released. So they're hopefully kind of waiting for a time, a safer slot to be released where they can kind of welcome audiences once more.
Right. Professor Chi, when you were here last year in November, you spoke in great detail about the challenges faced by those in the performing arts sector.
Right.
Now, I understand that these challenges have been aggravated amid the third wave. Could you tell us a bit more about this?
Yeah, actually, the performing arts industry have definitely been impacted a lot due to the current situations of the COVID-19. It's actually similar to the movie industry, but a little bit different. So since the beginning of December, when the social distancing level was raised to 2.5, a number of large-scale shows have been temporarily closed, actually. So it was actually a huge loss because especially because the holidays are usually one of the peak season for the performing arts. So, and in terms of its ticket sales and popularity, but they had to close all the shows or delay the schedule. So the producers actually had to refund the tickets to the audiences, and the audiences had to rebuy the tickets for the change in schedule. So it was a huge mess and a huge loss. And even though some of the shows are still running, but they had to adhere to the 2.5 social distance protocols, which is keeping 2 empty seats between each audience member, which means actually the theater venue can only be filled up to the 30% of the capacity.
And I was just going to ask you about that. So under tougher social distancing measures, you can only have a limit. There's a limit. There is audience capacity to be limited to 30%, like you just mentioned. But,
yes.
But shows are still being staged despite the potential losses. Why?
I believe that is primarily because the producers and the companies have already done a lot of work, hard work to mount their show. So it's going to be a lot of disappointed, it's huge disappointed for them if the show were completely closed. And also additionally, if the industry is shut down, such as like a Broadway theater business, I mean, countless number of people would lose their jobs, and that is devastating for the business itself, actually. So the industry actually trying its best to avoid such situations. That is one of the reasons that I think. And furthermore, unlike Broadway in New York or West End in London, the theater performing arts industry in South Korea doesn't really have a strong organization to make like a group decision, the collective actions or theatrical unions to protect the members. So actually, each company had to decide for the shows to be open or to be closed.
I see. So it's an individual decision then?
Individual decision, and they just wanted to keep their shows on go on for the creative teams and staff members and actors and the audiences and the producers themselves as well.
Right. And you mentioned London's West End, which is why we take a moment now to turn our attention to the arts scene over in London's West End, where theatres have been mostly shut since March last year in the wake of the pandemic. I have Professor Alan Reid from King's College London live on the line. Welcome back, Professor Reid.
Thank you very much, Sunny.
Now, Professor, I understand some West End theatres opened doors at the end of the second lockdown in early December, only to be forced to close their doors days later as London moved into Tier 3. Please tell us a bit about the plight faced by those in the performing arts industry there.
Well, thank you for inviting me, Sunny. It's so interesting listening to Professor Chi there, because our situation in London, I think, is almost uniquely bad. It really has been desperate over the last 6 months. Government strategy hasn't helped at all. It's staggered from pillar to post, as we would say. It really has been rather chaotic. And we are a relatively small island country. And listening to your Japan correspondent earlier, talking about the situation in Japan reminded me that we have 85,000 excess deaths through COVID-19 over the last 9 months in the UK, where Japan actually has none, zero excess deaths. And that really does indicate the catastrophic state that the UK has been going through. And while I am a theatre specialist, I am, of course, deeply concerned about the context within which I'm discussing these aesthetic and cultural questions. But to focus on the question you've asked me, which is the reopening of the theatres, we've had some chaotic experiences. Our track and trace system, I think, has been quite chaotic, very, very expensive. £22 billion invested in a track and trace program that very few people have any confidence in. And I do think the Korean situation, the theatre, depends upon track and trace in terms of its being able to operate. And unfortunately, we do not have a system that's adequate. We can't reopen. The furlough situation, that's the money given by the government to artists, has really been inadequate for those most creative people in the sector, directors, writers, choreographers, musicians, those people not perhaps working in major organisations, but at the fringe of things that make UK theatre what it is. A third thing, I think, has been the government strategy overall. During the summer, we've driven the numbers down remarkably well. We were doing, I think, quite well after a terrible first phase of deaths. So in June and July, things began to improve. And the first thing the government did was to create a new programme for eating out. It was called Eat Out to Help Out. And it insisted on Mondays to Wednesdays that you go to a restaurant and have a subsidy to eat cheaper food. Now, this served people who had money already, people who can go to restaurants, but it also effectively encouraged people to sit indoors. And we now know the impact and effect of that. I'm not saying that the deaths that arose from that, and there would have been deaths, would have changed everything. What I do think has happened is that the government's signalling has been really chaotic, which leads us to your point about these December reopenings, where the National Theatre and the Royal Opera House opened productions for a single night after weeks of work. And these shows were put on for a single night and then closed again. And Professor Chi and other viewers that you have today watching this program can only imagine the desperation of artists in that situation. So I do think we've been in a critically bad situation in the UK. And unfortunately, at the moment, the figures, as you heard earlier, are really terrible and continuing to be very bad indeed.
Right. Professor, having said that, what countermeasures are being drawn up or are necessary, in your opinion, to ride out the prolonged closure of theatres there?
Well, Sunny, you know I'm optimistic, and by nature, as a theatre person, we have to be optimistic. And what has been remarkable across the United Kingdom has been, not just in London, certainly across the whole of the United Kingdom, has been a response from some of the most radical, smaller, avant-garde, marginal companies working with local communities. I proposed on this programme about 6 months ago, when we last spoke about this, that perhaps we ought to consider evacuating the building. And by evacuate the building, what I meant was that we shouldn't go on dreaming a pipe dream that we could go back into theatres anytime soon. My proposition to you 6 months ago was that what we should do was to leave the theatres for a year, to move out into the communities, amongst communities, and work with those communities where we could, where it would be safe, and perhaps have works and kind of improvement programs developed in and around the theatres, so that when we reopened, and I thought possibly when vaccinations arrived in the summer or in the autumn, that things could improve and we could return to theatres. But unfortunately, what's happened has been that the policies which have been going kind of on and off, has meant that kind of programme has not been followed in general. The remarkable examples of work that are happening, I'll just take one. There's a really extraordinary company in the north of England, just outside a big industrial city called Leeds, in a place called Beeston, and it's called Slung Low. And that company and their director, Alan Lane, have turned their attention to distributing food for the local community, for supporting those people less able to support themselves, and opening their theatre as a community centre effectively for those people to come and engage with a programme of support that really is at the heart of the civic nature of the community. And I do believe those kinds of examples are extraordinary. The Stage, our newspaper in London for the theatre, ran a recent list of 100 people who've made a great contribution. I'm not a great one for these kinds of lists, you know, the 100 best people during a pandemic. I'm not sure about that. But there were some remarkable projects included in that list. For instance, a young producer, Ellie Keel, who's been working tirelessly through the pandemic, supporting women in work in the theatre, particularly following the Me Too movement of the last couple of years in the theatre, thinking about ways we could improve a theatre for a future beyond the pandemic. And that's where I really see the hope lying. I don't particularly think the larger institutions have responded that well to the challenges they face. It's much more difficult for them. But I do think our smaller institutions, our creative figures in communities have made remarkable strides. And I really hope this is a lesson learned about sustainability in the theatre in Britain. We shouldn't be relying on a tourist model. We should be thinking in a much more complex way.
Right. Professor, commendable acts of compassion right there. Now, I suppose compared to their counterparts elsewhere, theatres here in Korea, Professor, have been fairly fortunate as they have been able to stay more or less open to audiences. What are your thoughts on this?
Well, it is remarkable. I mean, obviously, the figures that we've heard discussed in your programme so far, and you discuss throughout each week and your programme runs, are so much lower than in the UK. And I think there is obviously some characteristics which make Seoul and South Korean theatre able to do what it does in very interesting ways. And I'm going to come back to Professor Chi on this in a moment and ask Professor Chi to give us more information, because it really does interest me that this very forceful approach to hygiene in the theatre, and that's even including the spraying of members of the audience, ensuring that people track and trace, ensuring there's follow-up. I heard at Phantom of the Opera there'd been an infection at the Blue Square Theatre some weeks or months ago. And I'm interested in this because there was this really extraordinarily detailed follow-up to this. And I do believe it may be changing now with the challenges you're describing. But I do believe in Seoul, at least, the theatre has done a remarkable job in trying its best to keep open for those people, as you, I know, rely on the theatre more as a place for sort of ceremony, a spiritual relationship and a sense of community. So perhaps this is a point at which I could ask Professor Chi to kind of develop that idea a little bit further, because obviously in London, we are simply not even starting. We're not doing well at this.
Right, Professor Chi, a response please then.
Yeah, I was wondering one thing, and then I wanted to ask to Professor Reid about I know the Society of London Theatre and the UK Theatre have launched a new scheme of which is called the See It Safely, which support the theatre and give the audiences the confidence that the venue is COVID secure. So, and they will be following the latest guidelines, which is similar to the guidelines for the performing arts in South Korea. So I just wondering, does it work? Does it work for the theatre business in London now?
Well, Professor Chi, I'd love to be able to say it has been tested, but we've been in such a chaotic situation, which is why I describe the context of our situation, because we haven't had an opportunity to really work this out. For instance, there was a remarkable David Hare play with Ralph Fiennes running at the Bridge Theatre for a few days, just during one of the periods that was out of lockdown. And this is one of the few phases during which time we've been able to test out some of these precautions. And of course, London theatres can have social distancing and so forth, just as other European theatres are doing. Indeed, during this period, my own daughter, who's a playwright, had a play called Fell on in a theatre just outside Zurich, where there was really some remarkable work continuing and going on throughout the period. There was no theatre in London. So unfortunately, I have to say, Professor Chi, that we really haven't had the chance to find out whether these things could work. We were hoping that during the pantomime season, that's the Christmas play season in London, which is very important for theatres, this could be tried out. But of course, a few days before Christmas was effectively cancelled by the Prime Minister, Boris Johnson. He'd been desperately trying not to do that because he doesn't want effectively not to be popular, of course. But this is our problem. It's too little, too late. That's what we heard earlier from Japan, and that's very much the case in London, I'm afraid.
Right. Meanwhile, Professor Chi, how do you respond to Professor Reid's question about our efforts here in Korea to keep our theatres safe?
I mean, I think the industry itself is quite different between two countries. So we don't actually we don't depend on the tourist market. The Korean theater market mostly sell the tickets to the local audiences, and the demographic of audience members are different. The largest group of theater audiences in South Korea is younger generation, like 20 to 30s. So the young patron audience have the kind of strong loyalty and enthusiasm for the live stages. So they just keep waiting and rebuying the tickets for the canceled. If the show is canceled or delayed, they just waiting and they just support the theater, and they have especially for the smaller shows, we call 대학로, which is like more off-Broadway or off-West End shows, smaller shows. So they are the audiences in this time at this moment, not the random audiences or tourist audiences. They are.
Professor Chi,
yes?
Could I respond to that? Yes, the images I see from Korea are remarkable because it's that youthful audience I see. It's incredibly hopeful, masked, enthusiastic, collective, entering the theatre. I've seen those pictures, they are remarkable. Of course, the vaccinations are on the way in London now, and that's because we have the centralised, beautiful National Health Service is going very well, with more than 2 million vaccinations already given since January the 4th. I am actually 18 millionth in line for a vaccination, so I think I've got about 3 months to wait, and I'm very happy to wait. I think the distinction now is those who can be patient and those who are impatient. And we do have to be patient in London because it is the only thing that I think is going to bring the theatre back. The vaccination programme, to my mind, really is where we need now to focus our energies.
Right, and that is a common goal. Of course, Professor Reid, as always, thank you very much, Professor, for making the time to join us live at this very early hour at your end.
No, not at all. It was great to meet Professor Chi and to hear from you again, Sunny. Thank you for having me.
All right, Professor. Right, meanwhile, back here in the studio, Mr. Conrad, a number of movies were released via over-the-top media service amid the pandemic. Do you see this online streaming service replacing movie theatres?
Well, this is a very interesting question, and this is something I think a lot of people are considering around the world. What is the future of cinema as we know it? People can't go to cinemas right now. When the cinemas open again in a more normal fashion, does that mean that the audiences will return the way they were in the past? A lot of people think that they won't. The question is, to what degree will they come back? Certainly in Korea, we've had, as you mentioned, a few films did switch over to streaming platforms. The first one was Time to Hunt, which was supposed to come out in February, and it was delayed just as the first kind of spike of infections was happening, and then that's pivoted to Netflix, and the next one was The Call a few months ago, and now the big film that'll come out during the Lunar New Year holiday will be online. That'll be Space Sweepers, the first big space blockbuster in Korea. Very significant because it was the most expensive film that was supposed to come out last year. And it was originally going to come out, and it was scheduled twice, and both of those were delayed. So what does this mean? How is the industry going to change after COVID, you know, if and when we get to that point? I think what could be interesting is we might be able to learn a little bit from history and look at the beginning of Hollywood, which was Hollywood really kind of shaped itself in the 1920s, and it became what we know it as now, chiefly during and after the Spanish flu of 1918 to 1920. Prior to that, the industry was very decentralized in America, and exhibition was largely, as we say, like mom and pop shops, just small little exhibitors, and they were forced to shut for months during that influenza, and they all went out of business. And then that kind of gave rise to vertical integration. So the studios like Paramount and MGM, they then bought cinemas, and the industry became stable and became what we know it as today. Now, vertical integration is no longer legal in America, although actually it's been reversed, but we do still have that in Korea. But I think what will happen with streaming is we're looking at just a sea change in the industry. So now companies are going to make films and TV shows for online rather than for the cinema, and there'll be kind of a hybrid of both. And I also think we'll start seeing that some of these big streaming companies, particularly Apple and Amazon, who have huge reserves of cash, when all is said and done, maybe they'll kind of go, hey, we just bought a big theater chain. So I think we're going to see some really interesting changes.
Right. And staying with that, Mr. Conrad, some observers believe that online streaming platforms will boost global interest in Korean productions, given the possibility of easy access. What are your thoughts on this?
Oh, absolutely. I mean, I think it's very interesting because in a sense it's kind of fortuitous that this happened immediately in the wake of Parasite winning the Oscar with the Oscars and being this kind of massive global phenomenon. That happened, everyone got excited about Korean film, then the pandemic happened and there was no new content, but everyone still remembered Parasite. And suddenly you have all this new online content and people are shifting online and looking at K-dramas all around the world. K-dramas are of course very popular already, but that's become even more so now. And you look at the top 10 of any given country in Netflix on any given day, and typically there'll be 3 to 5 K-dramas in there, whether that's Malaysia or whether it's the UK. So that's very, very impressive. And we're seeing just a real change in terms of Korean content is changing now to suit the global market. It used to be that Korean content was made for Korean viewers, but now we're looking, the audience is broader and the tastes of the international audience are a bit different, so we're seeing changes. A really good example of that would be the recent Netflix hit, Sweet Home, which is a big budget monster webtoon adaptation, but very different from kind of normal Korean TV content. That's a project that actually wasn't very well received when it initially opened in Korea, and then it was very well received around the world. And once people got excited about it around the world, then the press locally got excited about that, and people then got excited about Sweet Home because foreign viewers were excited about it. But we're seeing this kind of a change of tastes. So I think that's going to affect a lot. Bigger budgets, different genres, and that's only going to keep growing, I think.
Right. I have to admit, I started watching it after the interest abroad. Professor Chi, virtual performances are also being held amid the pandemic. Mm-hmm. What tasks need to be tackled by those in the performing arts industry to allow for a better replication of the live audience experience, do you think?
As you know, that the core value of the theater is being live and interacting live. So, I mean, the filming live stages or making virtual performances wouldn't give the same experiences to the audiences as those of here and now at the venue. So it's totally different. So I think more about watching it's similar to the movie business. It's everything, the environment, media environment is changing. So watching theater, watching performing arts on the media platform alone at home is quite different, and then it's inevitably is a lack of the spectatorship. So I think we need more the technical support to enhance the interaction between the performers and the audiences, or between the remote audience members. And I believe that would be more improve the theatrical experiences, virtual theatrical experiences to the audiences.
Right. Mr. Karan, the government here recently expanded its state employment insurance program to cover artists as well. What are your thoughts on such efforts?
Welcome, certainly, but also in a practical sense, quite difficult to implement. Artists typically are going to be freelancers, and the work can be spotty at best. And how do you kind of manage that very effectively? But they are trying to do that. I think it's artists who can prove that they're making $500,000 a month, even if it's like cobbling together several contracts. They can apply. They can have a kind of employment on insurance. But a lot of people, might not even make that, and different months are going to be quite different. So that is difficult. But I do think that in general, the Korean government has been quite vigilant about these kind of non-permanent workers in the arts industry. A few years ago, the Korean Film Council instated a regulated standard contract for film crews, because film crew members used to be, it was kind of infamous how they would work extremely long hours and not get paid very well, not have a lot of rights. But now that's changed completely, and that was a few years ago. So people are conscious of it's not just the stars and the directors and the investors. A lot of people involved in making a film, and they have their own livelihoods that they need to look after. So it's not easy for anyone, but it's something at least.
Right, I guess we'll just have to wait and see then. All right, Mr. Karan, thank you very much for your insights. And Professor Chi, as always, thank you for being with us today.
Thank you so much.
Right, we have the weekend coming up, and prior to the pandemic, it was a time for trips to theatres, for movies and more. Hopefully that time will be back in the near future. Have a safe weekend and see you on Monday.
As the